I was reading through some patient forums on Reddit and Quora last night, and there is this incredibly consistent, almost tragic pattern. People post things like, my symptoms come and go, so maybe it's fine, or I'm terrified of getting a colonoscopy, and then they wait. They wait for months, sometimes years, because they don't know which specialist they actually need, or they're just, hoping it goes away.
Oh, absolutely. That it comes and goes loop is a massive trap. People normalize things like persistent heartburn after dinner, or this bloating that slowly, quietly gets worse every week. And they just decide, okay, I guess this is my new normal now. But the thing is, heartburn or sudden changes in your digestion, that's not just a quirk. It can be a real sign of acid reflux, food intolerances, IBS, or even IBD and liver issues.
Right, and your body isn't like being dramatic here. It's sending a literal signal. But when people finally decide to do something, they get totally overwhelmed. Like if you live in Brooklyn, how do you even begin to choose? There are, dozens of GI specialists?
Actually, the team at ScoreDoc recently did a deep dive into this. They analyzed 15 different gastroenterology clinics right in Brooklyn for their 2026 report. And what's fascinating is how they filtered them. They didn't just look at who had the most 5-star ratings overall, because, let's face it, some of those reviews could be 5 years old and totally irrelevant now.
Wait, 15 clinics? That's actually a lot of competition. So how far back did they look to keep the data fresh? Because a clinic's staff or their whole front office dynamic can change in a year.
Exactly. They strictly looked at the last 24 months. Anything older than 2 years, they treated as outdated. They tracked Google, Yelp, and Facebook, looking at review volume, how recent the posts were, and the actual sentiment trends in the written comments, not just the raw stars. And out of those 15, only 3 clinics consistently showed strong, stable patient satisfaction patterns across the board.
Okay, so who actually made the cut? Let's get into the actual shortlist.
Right, so the 3 that stood out in Brooklyn are Atlantic Gastroenterology, New York Gastroenterology Associates, and Park Slope Gastroenterology. But we shouldn't think of this as a best in the abstract ranking. It's more of a high-quality starting point based on actual patient experiences.
Atlantic Gastroenterology? Okay. I was looking at their data, and they have a 4.9 rating on ScoreDoc with over 280 reviews, and 43 of those are super recent. What stood out to me in their patient feedback wasn't the technical stuff. It was the conversations before any procedures. Patients kept talking about how the doctors actually listened and explained the why behind the tests.
That is so critical, Daniel. I mean, think about it. If you're nervous about a colonoscopy or an endoscopy, which, let's be real, almost everyone is, the procedure itself is only half the battle. The anxiety happens in the waiting room and during the initial consult. If a doctor just hands you a prep sheet and walks out,
Oh, that's the worst. You feel like a widget on an assembly line.
yes, exactly, an assembly line. That's why that pre-procedure communication is everything. And New York Gastroenterology Associates, they're over on Court Street, they also landed a 4.9 rating, and their written reviews show a 98.2% positive sentiment. Patients specifically mentioned feeling incredibly reassured by how attentive the physicians were during those stressful initial consults.
That 98.2% positive sentiment is wild for a medical clinic, especially when you're dealing with issues that are, let's be honest, kind of embarrassing to talk about. Digestive health isn't exactly easy dinner table conversation. People feel vulnerable, so having a provider who doesn't rush you through the awkward parts is a game changer.
It really is. And the third one? Park Slope Gastroenterology on 9th Street. They actually have a perfect 5-star rating on ScoreDoc. Now, their review volume is smaller, about 28 total reviews, but their sentiment trend is a flat 100% positive. People rave about how accessible the doctors are. Like, you can actually get your questions answered without jumping through 10 administrative hoops.
So if a listener is sitting there right now trying to decide between these three or any clinic, really? What's the move? Because comparing a 4.9 to a 5-star rating doesn't actually tell you who to call.
Right. We need to stop asking who is number one and start asking personal, practical questions. Like first, does this clinic routinely manage my specific symptom? If you're dealing with chronic acid reflux, you might want a different focus than someone who needs a routine screening colonoscopy. Second, is the office location actually convenient for follow-ups? Because if you have to take 3 subways while dealing with a flare-up, you're not going to go.
Yeah, the transit struggle in Brooklyn is a very real factor. And I'd add a third question. Did the physician explain things in a way that actually made sense to you? If you leave the consult feeling confused or like you couldn't ask your real questions, that's a massive red flag, no matter how many stars they have on Google.
Completely. It's about finding the doctor you feel comfortable talking to when things are, well, uncomfortable. If you want to check out the full breakdown and the reputation scorecards for these clinics, you can find the whole guide on ScoreDoc's site. But the main thing is, just don't keep putting it off.
Yeah. Listen to your body. Don't wait for the symptoms to force your hand. All right, talk soon, Ava.
Talk soon, Daniel. Take care, everyone.